Hello, everyone. This is Frederick on behalf of the Collaborative Care Collective, and I'm extremely excited to be here with my mentor and colleague, Gregg Johnson. How you doing, Greg?
I am doing great, Chris, and hope you're doing the same.
Thank you, I am. And we're going to get right into it about your presentations. I'm extremely excited about your presentations as well. You're doing a lecture presentation as well as a laboratory practical.
Yep.
And so basically, I'm going to ask you what excites you about your presentation, and I'll tell everyone the title. It's Correlating Fetal Foot Shapes and Positions to Activation of the Core and Lower Extremity Neuromuscular Function, which you're speaking on at the next C3, we call it, Summit.
That I am. But first of all, Chris, I just have to say for those who are watching this, strongly consider attending this conference. You will be amazed at the level of knowledge that each of the presenters will have, that I think in a lot of cases are going to really help your patients. And second of all, being able to be in an environment where there's collaboration between various different professional groups is such an inspiration for me to be a part of this and to start really learning what many of the regenerative doctors are doing and the progress they've made in just the recent history in those areas. So that's first of all, I just really wanted to encourage everyone to join us. Um, I would first of all say that early on in my career, I was really blessed to be able to spend 7 years under the tutelage of Maggie Knott, the developer of PNF, she and Dr. Henry Cabot. And she was an out of the box thinker. The way she treated the body was to see it as a whole. We would work on the foot and ankle to be able to facilitate an upper extremity or the head and neck. She believed in the developmental sequences being a very important aspect of the care that we could provide. And so I've been fascinated with the body as a whole. And even to throw in, during the time I was at Kaiser Vallejo, I was seeking outside of the medical profession um, approaches. And so got very heavily involved in Rolfing and Feldenkrais and Aston patterning and Alexander technique and Heller work and Traeger work. So many of these that were developed during the 60s and 70s as part of the human potential movement, whose views were let's work on individuals for quality of life, which is a paradigm that I wasn't raised in the medical profession. I was raised in how to treat pathology to get somebody back to where they were. And so these influences were huge on me, which led me to my fascination with feet. So, finally, to your question, uh, to me, the feet are fascinating. How we can stand on such small real estate and have balance, how we can run, how we can climb, how we can do so many things with these feet, and how it's so organized from the feet to the brain. It's that connection of the nervous system that I find so fascinating. What really hit me in my early years of treatment was how many feet just didn't look like they should. They just never seemed to be efficient. They didn't look like they were doing what they should. And we were lucky to take our boys to Africa. And I got a chance in Africa to spend a lot of time with the Maasai tribe. And looking at their feet just absolutely blew me away because they were dynamic on their feet. I didn't see any supinated feet. I didn't see any flat feet. All I saw were feet that had spring to them, that had shape to them, that had purpose to them, it looked like, which really led me down the whole path that I'm talking about. Is that my current theory is a lot of what happens in first world countries' feet has to do with how large we are within the womb. And that cramped space is what really affects primarily the cuneiforms and the calcaneus. And that that is one of the primary. Secondary is how soon we put them in shoes when infants are there, instead of allowing those feet to really develop under the surface that they're underneath. Getting them on the beach regularly, getting them in grass, not necessarily concrete. And so that's what my lecture is about, is looking at the present state that we see among many of our patients and how those foot shapes a lot of times are really there since they were infants and they've never really adapted or changed. So that's the theoretical construct that I have. Now, how those feet connect to the core. Uh, Early on with PNF, what we discovered is that when I would do a lower extremity pattern, and let's just talk about the two flexion patterns, flexion adduction, which has dorsiflexion inversion with it, or flexion abduction, which has dorsiflexion eversion. So they're opposite eversions. And what I learned early on in doing these patterns is that somebody who had a pronated foot or a flat foot had real difficulty being able to get dorsiflexion inversion because they always expense themselves in plantar flexion eversion, and that they couldn't access inversion, and I could not get their trunk in. And a large part of what Maggie taught us early on was everything that we did in resistance was to get the trunk in. Now, we didn't call it the core back then, but that is exactly what Maggie was after, was developing the core. She recognized its limitation in orthopedic and neurological patients. And then those with a fixed supinated foot, really it's a struggle to get dorsiflexion eversion, so they are really struggling with the flexion abduction pattern, and you can't access the core in most of those. And so then I started correlating the fact that they could get core according to the shape of their foot, but because they were a fixed foot, both of them, they no longer could really access the core with that movement that they don't do. Therefore, we see a lot of the injuries, a lot of the back problems, and everything else, hip problems, along the lines of the shape of their foot and their inability to access the core. Now, there's lots of other factors that go on with foot shape, from the knee to what happens at the ankle and at the hip. But the main thing I'm going to be focusing on is the importance of that feed forward mechanism, that ability for the core to have the contraction before we initiate a motion, to be able to create force closure in our system to better be able to help it to stabilize.
Wonderful. Well, how this is so exciting to hear. Pardon me, that whole integration, especially with starting with the fetus or the embryo to fetus, the development part. So, how will this benefit your lecture will benefit physicians as opposed to PTs, as opposed to movement professionals? Just
Yeah.
maybe the one thing that works for the physicians to open up, let's say, their eyes, if not their thinking, compared to PTs and to allied health movement people.
It's a great question, Chris. And I can only hope that how it'll impact them. First of all, most physicians don't really get involved a lot with feet unless they're an orthopedist. Podiatrists have kind of taken that over. But hopefully, physicians, particularly the regenerative ones, will start being able to start identifying different patients in their foot shape and understanding that that foot shape doesn't have to be permanent. We have treated thousands of patients that we've completely changed the shape and function of their feet and get them so that they now have that dynamic ability to do dorsiflexion inversion, dorsiflexion eversion, and to be able to access the core in both of the patterns. that's simplistic a little bit, but hopefully they'll see that and be able to understand that sending to the proper medical care practitioner, the proper physical therapist, who really understands the care of the foot, might really be able to help that patient.
Great. And so for the physical therapists, movement people,
Physical therapists and movement people, again, I think a lot of them will resonate with the talk because
yeah,
it may help to answer some of their questions, but hopefully it'll also reinforce many of their already present theories and and ideas about foot care and what happens with the foot. Uh,
excellent.
the problem within the physical therapy profession as a whole is that we believe, if you go to many of the foot and ankle courses, that the foot and ankle are a fixed structure. Very little can be done for it to change it. Therefore, the only option are orthotics. And for me, the last line of options are orthotics. I'm glad we have them available because there are individuals who absolutely function better with an orthotic. But I don't want to start with orthotics.
Excellent. So let's take it to the lab or the practical aspect. You do another presentation in the lab part called How to Identify Foot Shapes and Evaluate the Foot to Core Connection, Introduction into Applying Manual Therapy to Enhance Foot Posture and Function. So that's really exciting for the physical therapists, probably more than the physicians, but any physician
I
should
would
attend.
agree.
Yeah, they should attend. And allied health, movement professionals, everybody should attend this one. Tell us about it.
Well, first of all, I'd like to say that there are physicians who really have become fascinated with this. Tim Mazzola dives in and wants to learn how to treat these things. I mean, he's one of those rare individuals that steps outside of his professional arena to learn in others. And to me, that's really an exciting component. I'm going to be trying to teach them just what we talked about. Teach them how to identify foot shapes, have them assess if they can access the core in those two patterns, and then teach them just some very basic mobilization of the cuneiforms and calcaneus that should be able to begin some of the process of freeing up that foot so that it has much more dynamic function to it, much more pliability and flexibility.
Excellent. Well, I think we'll end it here. Thank you so much
You're
for
welcome.
talking about what you are certainly passionate about. And again, it's a collaborative care collective in June. This is 2026. You go to collaborativecarecollective.org .com for any information to register and for all of the details and all of the speakers and all of the courses. Again, I'm with Gregg Johnson, who is my mentor in feet and all things from feet to core and above. We
Thank you,
welcome,
Chris.
you're welcome. We welcome your attendance, one and all. Thank you.